BronxWorks and the New York State Department of Health have come together, providing counseling and assistance to Bronx residents who do not have health insurance. Now, joining us now to share more about how you can obtain these services is Betty Ann Temesar, who's the program navigator. We welcome you to the show.
Thank you so much.
Good to have you. So when we talk about health insurance, we know that many Americans have suffered with not having it. Here in our borough, we know a lot of people as well. But affordable health care is available. Let's give people a little bit of insight.
Okay, so before I actually begin speaking about the Health Benefit Exchange Navigator program that BronxWorks is going to begin operating in October 2013, I think we should begin the conversation by speaking first of all about the Patient Protection and Affordable Care Act, which is most commonly known as Obamacare. Right, because Obamacare is directly responsible for the formation of the New York State Health Exchange, which will begin operation, as I mentioned before, in October 2013. So Obamacare was signed into law in 2010. It was upheld by the Supreme Court in 2012. It is the law of the land. So Obamacare aims to reform healthcare as a whole in the United States through several ways. It aims to change the way that health insurance companies currently operate. It aims to expand Medicaid, to reform Medicare, and to provide access to affordable health care for all U.S. citizens and legal residents. And it provides two very important mandates. The first mandate is that all U.S. citizens and legal residents have to have health insurance by January 2014, or they will face a fine of 1% to 2.5% of their income. And the other mandate states that small businesses that employ 50 or more full-time employees will also have to provide health insurance to their workers or face a fine. And this is going to be effective in 2015. So I think it was scheduled to begin in 2014, but they've been given an extension.
So give us a little bit about this, because here in the borough of the Bronx, it's estimated about 177,000, which I think is a low number.
Yes.
Is found to be uninsured in our borough. So for those people who are uninsured, if there's somebody out there watching right now that says, listen, I don't have health insurance, can't afford health insurance, I'm still in between, not understanding this full thing about Obamacare, what happens for them?
So they would, of course, be the people that we would be focusing on. So the Health Exchange, which BronxWorks is going to be running in conjunction with the Department of Health and Department of Finance, will be stationed by in-person assistants or navigators. And these navigators will assist individuals, families, and small businesses to shop for insurance, to compare prices, and to purchase insurance. The exchange will also assist these individuals, businesses, families, etc., with screenings to see whether or not they will qualify for subsidies or tax credits, which will allow them to pay for the health insurance.
So pretty much as a navigator, your job is to navigate between the person who doesn't have the insurance and putting them in touch with a health care plan and all the necessary information. How are you going about finding these persons, if you will, who are not uninsured?
Okay, so right now we are in the starting up phase. The program is in the starting phases. BronxWorks, as you know, runs several programs. So we're going to begin first with our programs by recruiting clients in the various programs, for example, the food stamp program, the single stop program, etc., who don't have insurance. We're going to go out in the community and do presentations. We're going to senior centers. We're going to reach out to the disabled. We're just going to do a lot of community activism to get the word out there, because there are a lot of people who currently have no idea what the Affordable Care Act is. So our job is basically to teach people and inform them what their rights are and what they're expected to do as of January 2014.
Let me jump in right there, because when you go out, you're supposed to let people know about what this new legislation is and how it really benefits them. Question is, when you go out there, you have these conversations with people and you let them know about it, what's the response that you're hearing?
It's positive. For example.
But a lot of lack of knowledge? Is there
a lack of knowledge.
Okay.
A lot of lack of people say, oh my goodness, I've heard about this, but I really don't know much about it. But for the most part, it's positive. For example, I have a client right now who I can't mention his name on air, but he is disabled. He's 63 years old. He worked for 30 years. he received Medicaid with a buy-in because he was disabled.
Mm-hmm.
Then he retired, so that was cut. And then he received Medicaid with a spend down, and now that has been exhausted. So recently I was speaking to him about Obamacare, and he's very excited because this is a gentleman who would otherwise not have any insurance coverage.
Mm-hmm.
So from people like that, it's a very exciting initiative, you know.
So you come into, so let's talk about BronxWorks for a second, because the BronxWorks office will be available to assist people. So people who are watching right now have the ability to just go to your office?
Okay, so the actual exchange is going to be up and running in October,
Mm-hmm.
at which point, yes, people will be allowed to come to our office. We're also going to be operating in 10 different sites. Right, 6 of which we currently control, and 4 we're working with other organizations. So if someone can come to BronxWorks, of course there are different sites, and we're trying to make it easy for people to get to. If somebody is disabled, we will have a navigator go to them.
So when you talk about the navigators, and your job is definitely to navigate between them and the healthcare providers, what does a person need to know coming to you? What do they need to know?
So they're going to be screened based of all, first of all. They need to know their income, family composition, basic things, because when they initially come to see us, they're going to be screened. So they need to have the day-to-day documentation so that we can access them and then see what they qualify for. So somebody coming to me should have papers showing if they receive Social Security or disability, or if they work, and all of that, those documents, so that we can verify those things and then screen them.
And also you have to be a U.S. citizen.
And you have to be a U.S. citizen or a legal resident.
Okay, so one of those two, qualifies.
Yes.
U.S. citizen or legal resident, then you have the opportunity to participate in those services.
Yes.
So now, after a person gets enrolled and they're working with you, how does it go? Walk us through it after that.
So again, the program is in its startup phases, so we haven't exactly, ironed out all the details.
Right.
We are yet to receive training from the state, which will occur at the end of the month, at which point I will have more information in terms of how that is going to be run.
Mm-hmm. So when we talk about the uninsured population, it says right now, according to the Urban Institute, about 177,000
Yes.
Bronx residents are uninsured, and I'm pretty sure that number is a little bit higher. Any way or any particular field of method that you're going to be doing to gather all these people who we know are uninsured?
We're going to be doing a lot of outreach, presentations, grassroots
right.
Campaigning to get people to come in.
Mm-hmm. So October is the day?
October is the day.
Okay, so October we want people to get ready to come on out, and then you come on out to BronxWorks, and then you'll be able to get hooked up. If you don't have health insurance, this is a perfect time for you to really get into the system. I want to once again take the time to explain a little bit more about Obamacare, so that way somebody's watching out there, you have the ability to know exactly what has to happen for you. So why don't we walk them through that one more time, exactly what has to happen. Everybody's supposed to be enrolled. If not, there's going to be a penalty incurred.
Yes, so like I mentioned before, there is a mandate that states that all individuals have to have health insurance by January 2014, or they will face a fine. BronxWorks is going to have an exchange that will begin operation in October 2013. So if anyone needs health insurance, we're open. You can come into us. We need to have income information, family composition information, things like that, and we will help you navigate through the system to, first of all, shop for insurance, purchase insurance, and any other help you may need.
Well, Betty, thank you so much, because I know come October, your hands will be full.
Thank you so much.
All righty. Thank you. Stay right here. And guess what? We got to take a quick break.